okay.
Yeah, we got the highest points for the...
Right.
I'm giving Morgan some tummy time, basically to stop his tendons from tightening inside his hips.
I love you, Dad.
I love you, unfortunately.
Dad!
Yes, Morgan?
I don't like this.
Yeah, only for another minute, all right?
But I don't like it.
I know you don't.
Dad?
Yes,
Can
mate?
I have a drink, please?
Yes, you can go have a drink.
And what else did you do?
We done work
Oh, okay. I noticed you got a sticker on though. What do you have a sticker for?
for winning a game.
Oh, okay. Go sit here. Jim, sit here. So you've had a good day, eh?
Yes.
My name's Anthony Bucco. I have 3 sons, Jack 9, Morgan 5 and Charlie 3.
My name is Roanna Gonsalves and I have twin boys, Kirk and Jaden. They're nearly 7.
When Morgan was born, basically from when he wasn't even a day old, we were visiting the clinics at the Children's Hospital.
2 weeks after Kirk and Jaden were born, Kirk was brought to this hospital for further tests because they didn't know why Kirk couldn't breathe very well on his own.
After copious amounts of visits, Morgan was diagnosed with Ulrich's congenital muscular dystrophy.
Kirk was diagnosed with vocal cord paralysis. He needed a tracheostomy, and so they put a tracheostomy in, which is a tube in his neck for breathing. And then a few months down the track, when he wasn't swallowing properly, they put a gastrostomy in when he was 1.5 years old.
We're also trying to stretch his neck muscles, which are starting to tighten up. So, yes, mate?
My neck hurts.
Okay. Well, I think we've been 5 minutes, so we roll you back now?
Yeah.
Okay.
I'll do it myself.
I have 5 children, ranging from 20 down to 6, which is Dominic. He was admitted to Grace Centre for Newborn Care at just under 2 weeks of age with congenital heart disease. It was very traumatic, to say the least.
My name is Tony Penner. I'm the Chief Executive of the Children's Hospital at Westmead. About 5 years ago, my son ended up in intensive care in this hospital. My experience as the Chief Executive at that time was quite telling in trying to understand how the hospital works at the coalface.
And who did you play with today?
Josh, Beatty, and Christian.
The first 3 months of Kirk's life were basically in hospital. He saw sunlight only once really on the way from RPA to here.
Can you hear now?
At first it was a very daunting affair. You were totally surrounded with people poking and prodding at your son and terminology that you had no idea what it meant.
And what?
You did feel a bit on the outer because you just didn't understand what was going on.
There's a sense of helplessness that really has to be countered by involving you. And if they give you enough information, you can actually assist with the decision making.
At first, being new to the experience, you don't know the fact that you have the right to question what a doctor says. You know, you're just so full of shock. Being able to have someone there to say to you that you are an integral part of your child's care, that's a very powerful thing for the parent, because the parent can feel very powerless.
I like something to eat.
You'd like something to eat. Would you like a chocolate milk?
Yes.
At the beginning, my role in terms of Morgan's care was very different to the way it is now. I was the breadwinner of the family, and because I couldn't be at the hospital all the time, one of the biggest issues that I had was I was looked on as the secondary carer.
Families who use the hospital are so diverse, you know. Different cultures, different religions, even different family structures. You have better outcomes if staff are sensitive to these differences and provide care in a way that fits in with families.
The child is part of a family, and that every aspect of the family has to be involved in the delivery of care to that child, not only the communication, understanding the interactions with the child, but also to be able to understand that this is the family that's going to be looking after the child when they go home. So it's absolutely critical that our clinicians focus on the child and the family.
Morgan still is of an age where he doesn't quite understand what are the long-term effects of his condition. So as a parent, I need to know that the care that he's going to be given will be a benefit for his quality of life, not just a clinical decision of, well, this is wrong, this is what we need to do to fix it.
Doctors and nurses here are in quite a position of power, and so when somebody abuses that power and talks down to you, it strips you of hope and it just makes you feel excluded from your child's care.
Wednesday afternoon's better, thank you. 7th of July.
Yep. Then you ended up in the hospital, didn't you?
My I had a hole.
That's
Staff showing respect for parents empowers the parents, and even from the child's point of view, they can see that my parents and my doctors and my nurses are all working together to make me better.
Just today we had an appointment with Kirk's respiratory doctor. He's always the first person to say, well, how do you think Kirk's doing and what do you think about this?
Do you remember how many operations you had to have?
15.
No, 2.
As a parent, we know our child. We are the experts on our child. We may not be experts in whatever field the doctors or the nurses are involved in, but when it comes to our child, we know them inside and out.
I've got the inside information and it just makes sense to tap into that information.
You make the decisions on the medical side, but we're there as consultants.
All right, Mum. You gonna do some tummy time?
okay. See you later.
A child comes into an organisation that delivers care by adults. The differential in power between an adult and a child is enormous. And the only person that can really be that bridge is the parent.
And here's some of the nurses looking after you. They helped you to get better. I think it's very important for medical and nursing staff to give parents an opening to ask questions, and not just on the one occasion but constantly.
The best conversations I've had at the hospital have been people who speak in a way that I can understand and who are open to me asking questions rather than giving me a whole heap of jargon in medicalese. Yeah.
Yeah, can you get my milk, please? Right.
Anytime a parent is in the hospital, their stress levels are rising. So I can't stress enough that if you communicate with the parents every aspect of their child's care, it will become a pleasant experience for everybody.
The parent-child relationship is the most critical relationship within the hospital, and we should never ever break it, we should enhance it.
When he was a little baby with a nasal gastric tube and a tracheostomy, he'd be asleep in the car. We'd have to get him out of the, in that car bucket seat. And he'd come into the hospital and open his eyes and smile. And I'm like, oh my God, this child's actually smiling in hospital. He likes it here.